Yeah, it's Dr. T. I want to talk now about surgical treatment for bunions. We talked about what causes bunions, what we should look for when it comes to pain, how we should address that pain. Here again, sometimes bunions get so large that they need to be surgically repaired. I was one of 10 guys that went all the way to Switzerland to learn the Swiss compression technique, which realigns the bones that are in question here. It's this angle right here between the first and the second metatarsal. What I do with this surgery and the repair, we address the structural as well as the positional and the functional problem that is causing the bunion. Here again, the bunion is crowding the second toe, or the slant or position that is happening to the toe. As you can see here, I'm drawing the metatarsals, those two metatarsals that I was talking about. Many times crowding the second toe, it will crawl underneath or crawl over the top of the second toe, and the second toe obviously will try to get out of the way. And there again, that causes another problem, the hammer toe, which we had talked about. In this Swiss compression technique, this angle that is formed between these two metatarsal, normally about 7-8 degrees. 7 to 8 degrees is the optimum angle. Many times we have people come to the office and they have severe pain, and this angle will be as high as 15 to 17 degrees, in which case this metatarsal needs to be brought over in this direction. Those tendons I had talked about earlier, the adductor tendon, which comes to the base here, tightens, that needs to be relaxed. The tendon here on the outside, the abductor tendon, needs to be tightened because it has actually lengthened or weakened. We will do the functional repair by loosening and tightening those two tendons, and then we address the structural situation. Structural being the large bump that is formed. We want to remove that, and then obviously we want to shrink this space. We have actually brought or narrowed people's feet a full ½ inch by bringing this bone over. It would be a cut at this end and at this end here to slide the metatarsal over. When you slide the metatarsal over, it has to be held in a position, and that's where the Swiss compression technique comes into play. We use 3 screws in most cases. We'll use a screw here, here, and here to hold that bone right where it needs to be after making those cuts. These are very, very thin cuts in the bone. Mind you, the bone needs to be put back to an optimal position, trying to accomplish obviously 7-8 degrees. It's not always the case, but our main focus is to remove the bump, the irritation, eliminate the structural, the functional, and the positional problem that we have, which can cause other problems. If you have any other questions or concerns, please feel free to contact my office and my staff will assist you. Thank you.